South African Health Products Regulatory Authority has approved 2 more Pfizer vaccines for use in the country. They are the Comirnaty Ready To Use adult vaccine and the Dilute To Use Paediatric Vaccine. But given the low uptake of vaccines in South Africa, it does beg the question about whether we need more vaccines. Professor Benjamin Kagina is the co-director of Vaccines for Africa Initiative, and he joins us for this discussion this morning. Prof, great to have you with us on the program. We'll get to the issue around the low uptake of vaccines in just a moment. But I want to start off with the issue of the Dilute To Use Pediatric Vaccine, because that's for children from the age of 5. This is new in South Africa.
Indeed. Good morning, Michelle, and good morning to your viewers. That's correct. This is Dilute To Use vaccines for pediatric population. Mm-hmm. And the important point to mention here is that initially when Covid-19 pandemic started, there was that general consensus that the disease was not affecting children as much. But subsequent data has shown that even pediatric population are actually experiencing quite a significant challenge when it comes to COVID-19 vaccines. So making sure that we've got vaccines that are safe and work in pediatric population is very good. So this is very good news for South African population.
Yeah, absolutely. So does this mean, Prof, that they've been approved now by Sahpra, that we can go and get those vaccines as of today, or is there a process that still needs to unfold?
Yeah, so it's good to separate regulatory aspect to recommendation that is given by advisory body, for example, the Ministerial Advisory Committee for Vaccines. So with the regulator, the mandate is very clear, which is to make sure that they look into the evidence of the product that has been developed by the manufacturer, and this mandate is to look at the safety of the vaccine, look at the quality of the vaccine, and more importantly, look at the efficacy, or just to say that the data shows that when the vaccine was tested during clinical trials, there is evidence that this vaccine works. Mm-hmm. So with that information, the regulator is able to see, okay, we see this vaccine is safe, is efficacious, and has quality that meet the standards. And after that, it's up to the advisory body to recommend these vaccines to the government.
So it still needs to pass that stage of before it's actually available at vaccination centers, at clinics.
Yes. So you if you recommend as an advisory body, if you recommend a vaccine that is not regulated, it means that has not been registered by the regulator. Mm-hmm. It means that even if the government wants to provide that vaccine, it's not available. So it's critical for the regulator to have these vaccines registered so that when advisory bodies recommend the use of these vaccines, then they are able to be made available by the government. Yeah.
So, Prof, it does, and I mentioned this in my introduction, it does beg the question in a context like South Africa, with our low vaccine uptake, whether we need more vaccines.
It's a good question. So I think before I answer that question, it's good to encourage our South Africans, those who haven't been vaccinated, to go and get vaccinated, because we know that these vaccines are safe. They do work, and especially prevent us from getting severe disease, which leads to hospitalization and, in the worst case scenario, death. So yes, we do need additional vaccines. Remember, one of the things that we do with vaccination is to ensure that there is equity. And in the context of this latest registration by Sahpra, it means that we do have an option should we want to vaccinate young population, the pediatric population, especially those who have comorbidities, who the data shows they also actually have quite affected by COVID-19. So if I look at the Sahpra website, so far we've got up to about 6 vaccines that have been registered, including the one that has been recently registered. So the more vaccines we have, it means that the more tools we have and the more access potentially we're going to have for these vaccines by the public.
Yeah, we just need to be careful about, I suppose, how we manage our vaccine stock. Just recently in South Africa, we had a situation when we had to actually destroy a few thousand vaccines because they were close to the expiry date.
Yes, and it's important to also mention, Michelle, here that having a vaccine registered by the regulator does not mean that the vaccine has been recommended by the advisory body. At present, only 2 vaccines in South Africa have been recommended. And if you look even at the conditions that are issued by Sahpra when registering these vaccines, is that they need to be used within the national vaccination program for COVID-19 vaccines. Yeah.
So, Prof, your advice, let me first start here. These 2 vaccines, the Comirnaty Ready To Use, the adult vaccine, and the pediatric version, the Dilute To Use vaccine, are they in use in other countries currently?
Yes, they are in use in other countries. So, for example, in the US and in the UK, they are already in use, and many other high-income countries, these vaccines are already in use.
And your advice to people who are listening to this, perhaps parents in particular, once there is that approval for the use of those vaccines in South Africa, particularly the pediatric vaccine, do you advise that it's just for immunocompromised children, or is this a protection that we need for our child population?
Yeah, that's an excellent question. Yes, so there is a guideline that is I presume is going to be issued around this by the advisory committee. But in the context of no supply constraint, it is critical that children have access to these vaccines, and particularly those at high risk with comorbidities like obesity or diabetes or HIV, and in some cases even TB. It is critical that they have access to these vaccines so that they can protect them from getting severe COVID.
Professor Benjamin Kagina, let me thank you for your time this morning, the co-director at Vaccines for Africa Initiative, on the approval of 2 more Pfizer vaccines here in South Africa. And interestingly, one of them is a pediatric vaccine. Previously, we were giving our children vaccines from the age of 12, but this is now from the age of 5. Just a note, it's been approved for use by the regulator. It's not quite yet available at your clinic or local vaccine center. Certainly a story we've got our eyes on for you.